G'day folks, this is just an introduction to surgical SCRAM, the way in which the bag is designed, and just a quick overview of how it's stocked. From the outside, this is a barcode, unique identification number, and RFID pouches which are located within the bag, which I'll come to shortly. The way in which the bag is designed is to face the operator or even the assistant, with the patient's head located to the right and the feet located to the left of how this bag opens. And the reason for that, when the bag opens, it still gives you access to the operating area. When we first open it, first thing you see is the protective equipment, gloves, headlamp, and a set of goggles. These are mirrored on both leaflets, and they are tear-outable. So basically the kit is replicated on both sides. You don't need to work it this way. It just gives you some versatility as to how one would operate. On this particular board here, if we just simply put it back and show you, we've got gloves, headlamp. It's all magnets to limit the use of Velcro. Inside this area here, this is your immediate access. So you've got your ChloraPrep, scalpel, Spencer Wells, and your tough cuts. And then this is just an easy pad, which is an adhesive pad for sharps, whereby once the sharp is stuck onto here and closed, it disposes of the sharps in a sharps box. So one is able to identify where the sharps are, which is a big hazard in these particular procedures. Both of these are mirrored, as you can see, and like I said, in this section here, it's just the goggles and a trauma pack. So when we go into the bag itself, you'll notice two distinct colors, red and gray. Gray is for clamps, red is for sharps, and at the moment this is the way in which we've stocked ours. Our vascular clamp is located underneath here, which is how the bag is designed. You could have two vascular clamps if you really wanted to, one under there and one under here, and the way in which they are removed is just as easy as that. Over here we have jiggly saw and handles, and then the stapler. This is the information section where you can either put action cards, or like we have Garter's checklist, which is after the procedure has been done. It's a check and response checklist, just to make sure that we haven't forgotten anything along the way. And then we've got a section over here for extra space, additional equipment that you may or may not want. Again guys, this is surgical SCRAM. If you have any questions, by all means reach out. Thanks.